Safer Births Bundle of Care is an evidence-based program equipping birth attendants with the skills and confidence to better manage the leading causes of maternal and newborn mortality. It has led to major reductions in maternal and newborn deaths in Tanzania. And I'm very pleased to present the background of this unique program and the remarkable results. In most of the world, the day of birth is the most dangerous day in one's life. Today, 6,000 newborns will die on their first and only day. 800 mothers will die due to complications of pregnancy and childbirth, today and every day. The majority of these deaths happen in low and middle-income countries and are preventable with good, basic, but time-critical care. Babies die because they are born asphyxiated and not able to start breathing on their own. This boy will die within minutes unless the midwife starts effective ventilation quickly. Young, healthy women bleed to death with anxious providers around who don't know what to do while they are waiting for a doctor who may never come. So how can we help? 15 years ago, the American Academy of Pediatrics developed the Helping Babies Breathe course to help train birth attendants in the basic life-saving steps of newborn resuscitation, focusing on effective ventilation within the first golden minute after birth. The course materials are visual and intuitive with much time to practical hands-on simulation training. The training tools are low cost and easy to carry, allowing for on-site refresher training and scalability. Based on the success of Helping Babies Breathe, a similar course for helping mothers survive bleeding after birth was developed by JPAGO with partners to address the leading causes of maternal death, postpartum bleeding. Again, the simulation training focused on only the most essential life-saving steps, basic steps to be done by the birth attendants. In 2010, we started the Safer Births Innovation and Research Project at Haydom Lutheran Hospital in rural Tanzania by testing the Helping Babies Breathe and Helping Mothers Survive programs. We did what was usual at the time. We provided a one-day Helping Babies Breathe course. We tested the midwives with simulations before the one-day course and 7 months after the course. Their simulated skills of newborn resuscitation improved from 40 to 80%. However, the same providers did not change their performance in the clinical setting. And there were no reduction in newborn deaths. There was no transfer of skill to where it was needed in the real life. So we sat down with the midwives and we asked what to do. And they said they needed to train more frequently within the real setting on site. They needed to be supported by their leaders, and everyone had to train, especially the senior midwives, leading the culture in the ward. So we tried it. We created a training station within the labor ward for short but frequent training known as low-dose high-frequency. And after only a couple of weeks, we saw changes in clinical behavior and improved performance in the delivery room. The changes resulted in a 25% reduction in fresh stillbirths and anywhere from 40 to 80% reduction in early newborn deaths, depending on the side. This was wonderful, but we still saw many unnecessary deaths, babies who could have been saved with more timely and effective interventions. So, together with healthcare workers in Tanzania, Safer Simulation Center and Ladal in Stavanger, we began developing new innovative clinical tools, replacing those that had been used for a century. Here you see the Moyo fetal heart rate meter for easier fetal monitoring. And here is the NeoBeat newborn heart rate meter for immediate and correct newborn heart rate assessment. We tested each of these new devices in separate randomized controlled trials and found that they were in fact more effective than existing solutions. However, new tools will not help anyone unless the providers know when to use them and how to best use them. Here is a midwife at Hydom practicing newborn resuscitation using the novel upright resuscitator and the innovative neonatally live simulator. The healthcare workers at Hydom also saw the need for team scenario training, addressing situation awareness, decision-making, communication, and urgent actions. Through a development period of around 10 to 12 years, we observed and studied over 50,000 consecutive deliveries, mother-baby pairs, and learned what worked and not. The evidence is published in more than 100 research papers. We knew that we had to put everything together in a bundle to really make an impact on lives saved. This was the start of the Safer Births Bundle of Care program.
Safer Births Bundle of Care is a program to improve quality of care on the day of birth. It addresses the leading causes of maternal and newborn mortality with a bundle of clinical and training innovations. Use of data and regular simulation training enables continuous quality improvement. And strong ownership by the Ministry of Health ensures the program can be sustained over time. Safer Births is based on 12 years of research and collaboration, resulting in more than 100 published papers. If scaled up nationally in Tanzania, the Safer Births Bundle of Care could help save 25,000 more lives every year.
We won an Innovation to Scale grant of $5 million from a division of the World Bank to scale up the program in 5 regions of Tanzania. We have studied more than 300,000 births in 30 hospitals over 3 years. We started the scale-up by training local simulation facilitators following the SimBegin program. These facilitators became fundamental to shifting culture from a blame and shame culture to a culture of improvement and learning. They facilitated regular on-site team simulations with reflective debriefings, supporting psychological safety and increasing provider motivation. The facilitators also reminded about and supported regular individual skill training. The Neonatally Live simulator provides automatic feedback immediately after a training session and encourage to practice again if necessary, with tips on what to improve. Another key role of the facilitator was to understand and use local training and clinical data for continuous quality improvement. Data from ongoing training and clinical care were collected and stored with easy access to the local facilitators and manager. They use the data to identify needs and guide local quality improvement and targeted training addressing these gaps. The improved skills were linked to clinical care, and then a new loop started. The continuous quality improvement methodology we used is based on something called the circle of learning. In Safer Births Bundle of Care, the first component, healthcare quality improvement statistics, is addressed by enabling easy access to data. Knowledge acquisition during training is aligned with national guidelines. Skills proficiency is achieved through self-regulated individual skill training. In Safer Births Phase 1, every healthcare provider has trained on average 2 times per week. The next component is facilitator-led simulation in teams. When providers manage the different skills, they can train in teams, focusing on situation awareness, urgency, decision-making, communication, and actions. In Safer Births Bundle of Care first phase, they have done 1 team simulation every second week on average. That is amazing when you know how understaffed most of these facilities are. What you learn during simulation and debriefing must be translated to clinical care. The impact is on lives saved due to better care. Findings from the first phase of Safer Births Bundle of Care indicates that there is a variation between the 30 sites in how well they have managed to implement all of the components in the circle of learning. The better they are, the higher impact, or more lives saved. We find a significant correlation between especially team simulation and increased patient survival. So it seems like the circle of learning also represents a circle of increasing impact, driven by competent facilitators and mentorship. But what was the impact? Well, I'm very proud to say that the prestigious New England Journal of Medicine decided to publish the main outcomes of the Safer Births program. This graph shows the combined monthly number of one-day newborn deaths over the study period. We used a step-wedged cluster randomized design, and you see how mortality is steadily decreasing as new regions starts implementation. A 40% reduction in risk of one-day newborn death was documented after implementation. The really big surprise was related to maternal deaths. Overall, an absolute 75% reduction in maternal deaths was documented. As far as we know, no other program have shown such results. We estimate that in just this first phase of Safer Births Bundle of Care, around 1,000 lives have been saved. Lives like Mama Tabu's.
Globally, bleeding after birth is the leading cause of maternal death. The Safer Births Bundle of Care is a program aimed at reducing newborn and maternal mortality. We are seeing remarkable results. A study published by the New England Journal of Medicine shows that after implementation of the Safer Births Bundle of Care, maternal death can be reduced by an astounding 75%.
Kwa sababu tulikuwa tuna changamoto sana ya vifo vya mama na mtoto huko nyuma, lakini mradi ulivyoanza umekuwa ukifanya hizi simulation course, on job training. Kwa hiyo watumishi wameweza kupata hizo skills na wameweza kuwa confidence, wamekuwa competent. Sasa wanaweza kufanya hizi interventions za haya maeneo ya huduma ya mama na mtoto vizuri na kwa wakati.
Watu wa huduma tunaweza kufanya mazoezi ya pamoja kila wiki ili kujengeana uwezo na kuongeza ujasiri katika kuhudumia wamama wanaopata changamoto zitokanazo na uzazi. Na hili ni muhimu kwa sababu tunakutana na wateja wengi wanaopata changamoto zitokanazo na uzazi.
Healthcare workers who were trained using the Safer Births Bundle of Care have been able to save more lives. Lives like Tabu's.
Alikuja kutoka zahanati kama PPH. Ametokwa na damu nyingi sana na walishindwa kutoa kondo la nyuma la senta. Bahati nzuri tulikuwa tumeshafanya mazoezi ya namna ya kutoa placenta ambayo imekwama. Kwa hiyo tukawa tuna jinsi. Nilikuwa nafurahi sana kumuona mama yuko vizuri.
Kwa kweli nashukuru akina dokta mapokezi walionipokea, walinisaidia sana kwa huduma zao. Asanteni.
on the very encouraging results from phase 1, we received additional funds from the World Bank to scale up Safer Birds Bundle of Care to all sea monk facilities in the same 5 regions, covering more than 300,000 birds every year in a phase 2. The Ministry of Health in Tanzania are currently leading a phase 3 in 2 other regions. Other countries, like Nigeria, are keen to replicate the success of this program in their most affected regions, with active implementations already established in Borno and Gombe states. In summary, what are the critical success factors? You have to ensure local ownership from early planning through implementation. Train local facilitators to drive in situ team training and culture change. Make data accessible for objective data-driven continuous quality improvement. Provide regular mentorship and supportive supervision. And establish systems for equipment maintenance and reprocessing. To date, collaboration and powerful partnerships have made this possible. So, here are the members of the Safer Birds Consortium. Thank you so much.